Hello, my name is Dr. Paul Richardson and I am the clinical program leader at the Jerome Lipper Multiple Myeloma Center and the director of clinical research there now at the Dana-Farber Cancer Institute in Boston. At the meeting, we are very excited to present data from our center under the leadership of Dr. Irene Gobriel and my colleague Dr. Jacob Laubach, exploring the role of a very interesting new cytotoxic drug called TH-302, which targets hypoxic tissue in combination with dexamethasone in treatment of relapsed and refractory myeloma. What we were very pleased to report is that not only was dose escalation successful and the establishment of an MTD clear at around 340 milligrams per meter squared given days 1, 4, 8 and 11, but excitingly in highly refractory patients we were able to see response rates in approximately 30% of patients. And this for an alkylating agent, as it is in fact, given in a way that it targets hypoxic tissue, though that's the uniqueness of how it works, and we think is very interesting and very promising in terms of the future. The next cohort of patients that will be explored in this context will be patients receiving bortezomib and dexamethasone with TH-302 going forward. And it's in this particular group of patients that I think we'll be very excited to see what responses emerge. Thus far, in terms of side effects, the side effect profile has been manageable. Mucositis was seen at higher doses, less so at the MTD, and very importantly, blood counts were the major issue seen across the study, but again proved manageable. So this potentially is a very exciting new chemotherapeutic with a unique effect in hypoxic environments, which of course underpin the very nature of myeloma, and thus could arguably be an exciting new cytotoxic chemotherapy that we could add to our current therapeutic armamentarium. Tumor-related hypoxia has been recognized as a very key and common phenomenon across most tumor types. In myeloma, we also realize that there is profound hypoxia in the area of tumors, and this has been demonstrated nicely from serial studies looking at myeloma involvement in the bone marrow. Hypoxia, critically, is the term that's used to describe the fact that in tumors, because they outgrow their blood supply, they typically do not have enough oxygen. This means that they grow in what's called a low oxygen or anaerobic environment, and in that setting, drugs that can uniquely access that hypoxic environment may have improved efficacy in the context of being able to more preferentially target tumor versus normal tissues.